Carol, and good morning or afternoon, everyone, depending on where you are listening in at and what time zone. We did yesterday's webinar, audio seminar on ICD10 on the code set itself, and today we're going to take a look at the implementation steps and how to get to where you are ready for ICD10 and the code set to be live and be used. So I did cut and paste or, reuse one of the slides from yesterday to today just to kind of get us started off and looking. When we're talking about implementation and when you're talking about the code sets, both ICD10-CM and ICD10-PCS, I think, looking at one of these kinds of slides will just kind of hit home to how many places ICD10 is going to touch. It is absolutely going to hit everywhere in the office. Where you have patient care or where you're trying to get a bill paid for giving patient care. Excuse me. So, and one of the things I did allude to yesterday and will put out in front of everyone again today is that whole idea of productivity and the hit that we will take to productivity as we start to prepare for ICD-10. There have been two studies published, the RAND study and the Nolan study. These are now a little bit older studies. They were done in 2003 and 2004, and they were actually done at that time when we were thinking about going to ICD-10, and they were asked to kind of look at it and give their opinion on what it would cost and those kind of things. But they are two very good studies in the fact that they talk about implementation and what it will cost to payors, what it will cost to providers, and things like that. So they are, if you go to the AAPC website at aapc.com, under the ICD-10 tab, you can find these studies there to look at, and they talk about timelines and things like that. So they're really good to take a look to help with budgeting and things like that, because we'll talk about that today as part of implementation. Of course, you always have to be thinking about our budget. Those studies also give you a good place to start when you're looking at numbers and things like that, trying to fix the budget. The thing to remember about those studies, though, as I just said, was they are from 2003, 2004, so they're already 5, 6, 7 years old. 2003, 2004, we're in 2011 now, so they're like 7 or 8 years old. So when you're looking at the dollar amounts that are in those studies, just remember that those are dollar amounts from back then, and that the dollar amounts for today may be higher because of just costs and things like that. So looking at this slide here, when we're looking at the impact and we're thinking about putting your steering committees together, which is one of the first things that we're going to talk about as a step, you want to look at these things and try to think about, who you want on these committees, who you want to be making the decisions and putting things together for your ICD-10 implementation. And when you look at a slide like this, you can kind of see, you're going to want someone from office management, of course, that's going to be in on there. You're going to need staff education and training. So you're going to want maybe an auditor, maybe a coder in there, of course, is going to be necessary. Changes in IT systems, so you're going to want your IT people in there. Possibly if cash flow disruption, you're going to want your billing managers in there. You're going to want a physician in on these teams. So I kind of talk about it as casting a wide net or a big net when you put these committees and these teams together. You don't want to have halfway into implementation something come up where someone says, oh, nobody thought of that, or oh, I wish we, and then all of a sudden you're looking and you don't have it in the budget. You didn't plan for this thing that came up. Something's always going to come up with a project this big. Nobody can think of everything. So, you're going to have, you're going to want to try to put some cushion money in your budget so when somebody comes and there's something nobody thought of, you're going to have a little bit extra to play with. But, you don't want that to happen a lot. And no one, even experts in their own areas, they can't know everything about everything in the whole entire organization. So you want to cast that wide net and get as many people from as many different types of jobs in on these committees and these teams, so that somebody will think of something that somebody else didn't, and those kind of things, so that there's less things that get left and get lost in the process. So when you're looking at those kind of things, this is a good little slide to come back to that just kind of gives a whole picture of, what you're looking at for ICD-10. Now, going through the steps, we're going to do a little step-by-step the way of, how to get to implementation. And the first one is to organize the implementation effort, and this is putting together those teams. Some places they call them steering committees, some places they're calling them project teams, whatever, you choose to call them where you're at. You're going to want your core people together that are going to be making the decisions and putting other teams together. The steering committee, they may say, okay, we have the big steering committee that we have, as you see here on this slide, managers and physicians and coders and compliance officers, as I said, casting that wide net, IT people. And from there, you're going to have other committees that come off of this one. So this is kind of your big guns committee that is going to be kind of passing out the assignments, so to speak, to the other teams and making, the big decisions. You want to try to get, administrators, things like that on here, at least one. This needs to have decision makers, on this committee. Somebody that when people are bringing things to you and people have put together a gap analysis, or they've put together a budget and they're bringing it, that there's, the people that are sitting on this committee, that there's a person in there that can say, okay, this is what we're doing, this is a go. Depending on the size of the facility that you're talking about, you may have a lot of committees, a lot of teams, or very few. If you have a two-doctor office, you're not going to have a steering committee, an education committee, a communication committee, because it's all going to be the same people. So of course you want to take a look at these things when we go through these steps and kind of either make it smaller to fit your practice or make it larger to encompass everything that's in your practice, or understanding that on your team, instead of 2 or 3 people, there may be 8 or 9, there may be a dozen, and you may make these committees or these teams split down even further. So you have to look at it from your own perspective of what fits for the facility that you work at. But the first thing is to get that core team of people together. So these need to be people that can work together, that can play well with others, and that can be cohesive and understand and think about the fact that this is for the greater good. This is for, the good of the organization to get us where we need to go. It's not the me, me, me show. So you have to make sure that the people that you're picking on here are people that, can kind of give up and work together, and that also are people that other people kind of get that buy-in approval from. So if you say, well, so-and-so's on the steering committee, and somebody, oh, okay, well, that's, so you want to kind of look for those kind of people too, the ones in your facility that people look to for things when something new is going on or something's coming down the pike, an expert in their portion of what you're looking for. So we call them now SMEs, the subject matter experts. So you also want to sit down and go, okay, well, if I needed to know about a coding issue, who is it that I would ask? It's not necessarily always going to be a manager. It might be, one of the head coders or lead coders in the group that would be the person everybody goes to for stuff like that. Well, that's a person you might want to be putting on the committee. So you want to make sure that there are people that really understand their area well and can convey that understanding to the committee so everybody can work and get to the goal of implementing ICD-10. Because this is, one of the hugest tasks we've undertaken in our country as far as healthcare, in quite a long time, and it's something that we haven't seen, probably for most of us in our working lifetimes, any kind of change like this that's come. So our next step is our communication plan. So once we have our big committee set up of, where we're going to have the big decisions coming down from, we need to look at a communication plan, how the committee is going to get the word out. You need to look and see for your organization what works best for you. I've had some where people will say, well, you can send me a newsletter, and put it in the inter-office mail, but, when I get it, it's going to go in the trash. I don't really read those, but if you send me an email with the newsletter attached as a PDF file, well, I'll look at that. And I've had some people that'll say, I get so many emails a day with so many things attached to it that if I don't know what it is, I just delete it. So you want to make sure at your facility the best way to get the information out and that everybody in the facility understands how you're going to send it. Because you don't want to be sending, if you choose to do it by like e-blast or something like that, and you have your distribution list set up, you don't want to be sending out these communications and nobody's reading them. Sometimes, if doing it by e-communication, you'll want to have someone sit down and kind of structure out, like here we're going to have managers in this distribution list. We're going to have physicians in this list. We're going to have coders in this list. We're going to have, and kind of split out, because the information that you send is not going to be the same for everybody. You're probably not going to be sending the physicians the same information that you're going to be sending the coding staff. They need to know a little bit more of the nitty-gritty stuff than the physician might. And so, you don't want to get it to where you're sending out so much information that doesn't apply to somebody that every time they see something from you, they just hit the delete button. So that's part of the communication plan, is how it's going to be, not just how it's going to be communicated, but to whom will it be communicated? How are we going to segregate or piece out these things for people so that we're sending the right information to the right people? And then, disseminating, developing those materials. Are we going to do a little communique? Are we going to do a newsletter? Are we going to have little information bullets that are sent to the office managers that they're going to read in the staff meetings? Are we going to send out links to people to go click on to read an article or to listen to a webcast about ICD-10? How are we going to do things like that? Developing that in ways that, most of the people are going to take the information, read the information, look at the information. And then your timelines, right now, if you're sending out a lot of stuff about the code sets themselves and you're sending something every day or once a week, because it's 2.5 years away almost still, a lot of people for the code sets and stuff, if you send out stuff that often, it's going to be overkill. They're not going to be paying attention to it. Again, depending on the size of your facilities. How often do you want to send things out? How much? Do you want just little paragraph kind of shots going out? So establish how often, and as we move closer to ICD-10, of course, those timelines and how often you do things should be getting more often. So things for right now, depending on which committee or which part of the step process you're in, you may be a little bit busier than other times. Of course, as we get closer, everybody's going to be getting busier with implementation and steps and training and all of that kind of stuff. So it won't be too far off in the future when everything is really stepped up and everybody's busy with all things. But so try to get some of those timelines set up and how things are going to be sent out. Our third step is an impact analysis. And this should be done by any practice. And what an impact analysis will be, we'll take a look at the resources that will be required for implementation. you may send out or start by sending out surveys to all of your employees. What do you know about ICD-10? What department do you work in? How many people work with you? What do you do with ICD-9 coding today? And then, what do you think you will do with ICD-10? How do you think ICD-10 is going to affect your office? Because once again, as I said before, even people on these committees, being the big thinkers and the people that are experts, they still aren't going to think of everything. So by doing an impact analysis and taking a look at how ICD-10 is going to impact each department, and by surveying your employees and asking them what do they think, there are a lot of good suggestions and a lot of things that you may get informational-wise that, once again, you were not thinking of or somebody didn't just catch. Now, depending on the size of your practice, that will, of course, drive, how long this step is going to take. The lesser amount of people you have, the quicker it will be to put the results together of this, which is kind of, sometimes it's not getting the information. It is, what do we do once we got it? I mean, if you have, 200-300 employees, and some places, of course, have more than that, and you send out these analyses and, you get these surveys back. If you do it on paper, who is going to sit and enter all of that information into a spreadsheet or try to put that in together in some kind of usable way that is going to benefit the committees that are taking a look at the information? It could be a very daunting task and a task that takes a long time. And you also, so I suggest using, one of those like online survey kinds of sites where you can, make a survey out of it that you can send to people that they can do electronically, and then you can get the information and put it together. What you're looking at in this impact analysis to see how it's going to affect the practice, and that is going to help with development of your budget. It may help you look at, how they use it now, and then think, as we talked about again on the first audio about the code set itself, in going from roughly 23,000 codes with all of ICD-9 volumes 1, 2, and 3, and then looking at the 170,000 codes that are in ICD-10, both CM and PCS, the procedural coding system. Depending on how people are using that and things like that from an IT standpoint, like hardware, software, those kinds of things, that can take up a big chunk of your budget if you need to take a look at those things and purchasing. So doing an impact analysis and seeing how the code set is going to be used in the departments once ICD-10 is active and live will really help you with budgeting and pulling out budgets. Our fourth step is organizing cross-functional efforts. Now, this is more for medium to large practices, that they are going to look at the people sitting on, lines of communication for the team who are going to be your decision makers, setting up those extra teams I was talking about before, or committees, and doling out the work. So we've got somebody working on a newsletter, we've got somebody putting together the survey that we sent out and putting that together for us. There's someone that's working on a PowerPoint presentation maybe to give to administration on the budget and our budgetary needs for what's going to be coming. So you can really have a lot, or looking at a lot of, depending on your size, cross-functional teams that can be working on a lot of different things at the same time, and pulling from those people or using those people, they can actually be used to establish the executive steering committee. The best people maybe out of each one of those cross-functional teams, can be pulled together to get your executive committee together. They will, of course, be scheduled meetings probably at the beginning of the efforts here. They may need to meet, once a month at the beginning to establish what they're doing, and then maybe once a quarter if nothing's going on, and then, of course, as we get closer, meeting more often. So the meeting schedules and things like that will just be driven by the size of your facility and, necessity. Also, the 50-10 project team, depending on your size, you may have an ICD-10 team and a 50-10 team. We talked about 50-10 again on the other audio, and with 50-10, of course, that is the electronic data set that will allow us to go to ICD-10 and to be able to submit the claims with the expanded code set, and also to submit more diagnosis codes. With 5010, we can submit up to 12 ICD-10 or ICD-9, because 5010 will go active January 1st of 2012. So depending, your IT people may be sitting more on the 5010 team at this time, getting everything ready for that, because that's more of an IT kind of issue, because it's the electronic data exchange set. And then once 5010 has been activated in January of 2012, then some of the people from the 5010 team, may come over to the ICD10 team, and start helping with that stuff. So depending on the size, will depend on how many, again, of these teams that you have. And then step 5 is to look at these costs. That's going to be a big step, is developing this budget, looking at software costs. And some people don't think about, when you look at those software, don't forget about the licensure, because sometimes the software might be pretty cheap, or it looks like it's inexpensive, and then you see, but then you have to license for so many people. If you have just one, then it's not so bad, but the more users that you're going to have with the software, the bigger that price tag is going to start getting. One place to look with your softwares, with your software contracts, is to look in the maintenance part of the contract and see if government-mandated updates are part of your contract. If they are, ICD-10 is a government-mandated update. So it may lessen a little bit of your cost of converting over to ICD-10. There, of course, still may be many other costs, maybe hardware. Maybe your hardware is getting old and it's not going to be able to hold ICD-9 and ICD-10 with how many more codes that we're talking about here. But the software itself, you might not have the bite of the cost for converting over and getting the ICD-10 code set delivered, so to speak, to your system. So that's something to look at. So again, in the maintenance part of your contract, you want to look for something like that. And then, do you need new hardware? Kind of the little ticker out there is that if it would cost more than 50% of a new system to upgrade the system you have, it might be time to look at a new system. So you need to make sure you're looking at that to see what your needs are. The implementation and deployment costs. Are we going to do it ourselves? Are we going to have somebody come in and do it? Do we need to upgrade our EMR system? Is it not going to be able to hold everything that's needed for it? And then, of course, costs for training. The biggest cost is probably going to be the software hardware costs. If those are not things that you're going to have to be looking at, then it's going to be a little bit easier for you to transition into ICD-10. At that point, your biggest cost will probably be staff training, because everyone is going to need some training. Step 6, internal system design and development, or customized systems if you have them. Some places, instead of going out, if they're larger, sometimes they will customize or make their own system. So if you do, same thing, you're going to need to look at the structure, determine the requirements, do your design work and all of the analysis and programming and things like that. So depending on how you, have your software, this step may or may not apply to you. Step 7, developing our training plan. Once we have it, our idea of what we're going to do, then we need to set up the plan for training. Most places are going to have phases of training, and I would definitely highly recommend that, depending on your size and on your need and the type of facilities you are. If you're a billing service that, or a coding service that all you do is code for people, your coding staff better know their stuff. If you are looking at all of your staff, you know, you're going to have different needs for different staff members. For example, a physician, while they're going to need to know about ICD-10, of course, is not going to have the same kind of training as the coder or an auditor or your staff educator is going to need. People that do your front desk stuff might not need to know the same thing as some of the other staff. People, what about your nurses and other ancillary staff maybe that work, you know? So someone needs to sit down and go through and say, okay, here's all our staff. Let's try to compartmentalize them or put them into groups. You know, we can have providers in one group, you know, and then we can have ancillary staff in another group, and then we can have, you know, the billing and coding staff in another group, and just kind of sit down and see how many you have in the different groups. Now, those studies I was talking about before, the RAND study and the Nolan study, when you go through them, they do both give some different kind of information on, you know, training needs and what they see as being necessary to train staff by looking at, like, Canada and Australia and some of the other countries that have converted. When we look at that, though, we have to kind of keep in mind, like Canada, for instance, until they converted over into ICD-10, they didn't use computerized systems. I mean, they were using DOS. So for any IT people that are listening, you know, they were pretty antiquated, and so they had to not only learn the ICD-10 system, but they also had to learn how to use encoding software at the same time. So some of their training time was spent doing different things. So in some cases, you know, you have to look at when they converted over and things like that. So for the studies, though, what they have said was that for physicians and providers, they're probably going to need around 8 to 10 hours of education on ICD-10. Depending on their specialty area and things like that, you may need to spend more or less time with them. And one of the biggest things that I have found so far in doing my ICD-10 work with our clients across the country is that with the providers, it's not so much the code set itself, because in a lot of areas that kind of detail is left to the coders, but it is more the documentation specificity. If you looked or remember from yesterday at the audio that we did in those slides with how specific the ICD-10 code set is, that's really where a lot of the physician training is probably, and the physician work is going to be needed, is to work with them on their documentation and showing them the specificity of ICD-10 and what they need to do to make sure that the coders can go ahead and code their work and get it out the door to get paid. So coding staff, it is said that the coders will need anywhere, and the range of the studies varies greatly in number of hours. Some of them will say that they may need 20 to 40. Some go as high as 60 hours of training. And some of them say, you know, like if you're an educator or an auditor, you may need closer to 80 hours. Now, once again, depending on what you're doing, ICD-10-CM or ICD-10-CM and ICD-10-PCS, the procedural coding system, may also drive how much training you're going to need. For the coders, it's more going to be about practice, about coding and doing, because that's how they're going to get the actual code sets and using the books and things like that ingrained. So how are you going to train these things? What are you going to use? What are you going to need to train them? Obviously, you're going to need some ICD-10 manuals, you know, but then are you going to make your own training materials and your own books and your own exercises to help them with the training? Are you going to go outside for training and get a group to come in and do the training for you? Are you going to send somebody out to do like a train the trainer, where you send one of your best people out and they go to a boot camp and they learn all there is to know about ICD-10, and then they come back and train the rest of the staff. But as I was talking earlier, you know, not forgetting about that productivity issue, if you do it and do a train-the-trainer kind of thing, whatever that person was doing before, you know, they're not going to be able to develop or devote their full time to continuing to do that. So whatever they were doing, someone else is going to have to pick up and help with what that was. So you're going to see, you know, their productivity on whatever their area was, you know, not being the same that it was pre, you know, training sessions when they start in with the training. You know, are you going to get most of it, like I said, we'll phase it out. So in this plan, you're going to see who needs phase one. And phase one, in my opinion, should be given to anybody that is in the office. You know, it's general overview of the system. This is what ICD-10 looks like. We have to do this because of, you know, the ICD-10 final rules that came out in 2009. So just kind of, you know, a general understanding of what it is and where you're going, and showing the format and structure kind of like we did yesterday. You know, something around like maybe a 4-hour training, something like that. You know, this would be something that, as I said, would be given to all staff, and for some staff that might be all they get. It's phase one and they're done because they don't need to get into depth on what's going on. For people like the coders and the educators and the auditors and people like that, you know, they're going to need a phase two. And depending on how you split it up, you might even add a phase three in there. Phase two could be more in-depth study that you are basing on, you know, where they, maybe their specialty area. And maybe just all coders get a phase two that is just more specific. It's more work, it's more examples, it's understanding the code set. And then you do another phase where you're going into each specialty specifically and doing extra work and letting them code things out. But, you know, as these people do these extra phases of training, those are going to, as you get closer, be more ongoing, where they are actively coding in the ICD-10 system, because you don't want coders to be at the point of, okay, now it's October 1st of 2013, this stuff is for real, I've got these ICD-10 books in front of me, but I really haven't coded too much with them. You know, their productivity is going to nosedive and pretty quickly and stay that way. So the more pre-coding that they can do, you know, the less of a drop you're going to see when the system goes live. But once again, that's going to mean that the productivity on what they're doing currently is also going to slow down a little bit. So it's kind of like, do you want to bite the bullet now, a little bit, or do you want to wait and bite the bullet and have it be a really big nosedive? You know, most places are starting to go in or thinking about the idea of, you know, doing the little bit, of course, is much more palatable. But once again, on the productivity standpoint, always keeping that in your head and thinking about it. So as I said with on this next slide about the training plan, how are you going to do it? Are you going to use webinars, distance learning, you know, the workshops, seminars, live? You can have people come and do on-sites privately. I, through the AAPC, you know, and the Physician Services Division, have gone and done customized on-sites for clients where they have us come in for a couple days, you know, on their turf, you know, on their schedule, you know, and we can hit a little bit more people that way and, you know, customize the training down to them rather than them sending 12, 13 people out, and how are you going to do that? And you're going to have to stagger them, and the cost of travel for all of those people and hotels and things like that. You know, so what manner are you going to do it? Conferences, you know, a lot of conferences now, if you look around, we have a lot of places that are doing conferences, and a lot of them will have some part of the conference devoted, at least a session or two you'll be able to find where somebody's talking about ICD-10. You know, those are things that can be helpful. I know that the AAPC in the year of 2013, when the coding system is going to go live, they're going to hold regional conferences, and the regional conferences are you know, going to be ICD-10 driven, to where, you know, that's what they're looking at for the whole conference. You know, those kind of things can be very helpful. Some of the webinars that you can see out there, a lot of people, like the webinar we're doing today for high tech, and you can find a lot of webinars that are out there with people starting to look at ICD-10. So, you know, it just depends on how people learn. You have different types of learners, and people take information in different ways. So sometimes, you know, as much of a different kind of taste as you can offer will help different people catch it in different ways and just kind of solidify it a little bit more. Then we want to contact our system vendors, which would be step 8. You know, taking a look at, you know, what am I going to need for ICD-10? Is the vendor going to convert? You know, you may see some of the vendors that when the 5010 update comes around, they may say, you know, we're just not going to do it. We've looked at the cost. It's just time for us to get out or whatever. So you may be looking for some new vendors. Look at the timelines that the vendor has for implementation. You know, look and make sure that they have a plan for the 5010 conversion. The level 1 testing for 5010 was due December of 2010. You know, so that'll be your first question. Did you do it? You know, and then, you know, let me see, and what is your plan for testing, and how are you moving through this? You know, maybe can I be a beta? Because if they're using you as a guinea pig, you know they're working on it. You know, what are going to be the costs for implementation? You want to ask these questions of your vendor and say, we're trying to make our budget. What do you think we're going to need? What is it going to cost? What are we going to have to do? And let them give you some ideas. Believe me, if you're asking them and telling them, you know, we want to make a budget, they'll help you with that. You know, they'll let you know. You know, when, and then the time schedules and all of those kind of things you want to be asking the vendors about. As I said before, with costs, the system upgrades, scanning, billing, financial analysis software, the EMR, you know, you're going to have to upgrade your electronic medical record. The estimate from those studies has been that the overall cost will be anywhere up to $1.6 billion nationally to convert. But again, these are figures, as I said before, that are from 2003, 2004. So, you know, nobody really knows what it's going to cost, but because we've never done anything like this before. Then implementation planning, you know, how are we going to implement this project through the organization? So some of these, of course, are going to overlap: the planning, the analysis, the implementation, education, testing, and production. Those are things that we are looking at to try to see how we're going to move through and get to our end result, which is implementation of ICD-10 and the code set. Identify the overall impact of ICD-10 during this phase. You know, look at the guidelines. You know, identify the impact of the changes to your particular facility or your particular department if that's how you're breaking it down. Look at the crosswalks. We do have that GEMS map that we looked at a little bit yesterday and showed a few of the little things on when we were doing some of those case examples. You know, and then some of them some organizations have built their own crosswalks. Internally, they're working on them. There's also other software that's out there that can be purchased for crosswalks, where outside vendors are making them now too. You know, look at the changes to your reports and your trending that you're going to look at things with ICD-10. As I talked about yesterday, just diabetes. You know, there's over 150 diabetes codes under 5 different categories in ICD-10, where we have one category in ICD-9. You know, so how are we going to look at that, and how is that going to change our reporting and what we're looking for? What kind of new processes might we need? What kind of quality assurance, what QA are we going to be looking at to make sure we're doing this correctly? Looking again at, you know, your reimbursements, what might impact your reimbursement. You know, pay for performance. Look at those kind of things that may help you get to ICD-10, give you some extra money. Do you do PQRI? You know, maybe you should consider doing the pay for performance to get some extra money. What about e-prescribing? Do you, you know, have you joined in with that program with CMS? These may be all different opportunities that are out there that may get some extra money into the practice to help with the conversion. And then look at the benefits, of course, of implementation when you're looking at it, how to achieve those benefits, who else needs help, looking at your vendors, contacting your health plans. How are you guys doing with moving into ICD-10? Again, as I talked about yesterday, the health plans and your payors are already knee-deep, some of them neck-deep, in preparing for ICD-10 right now because they're working on their review policies and they're working on their audit plans and they're working on, all of those kinds of things so that they're having to study and learn and convert over their stuff now. Looking at your communication plan, monitoring your training. How is the training going? Are we getting a good ROI? Is our return on investment paying off? If we had paid for these webinars for everybody to come to this distance learning thing on ICD-10 and nobody can tell me anything about it once it's over with, well, maybe we need to look at it a different way. Maybe a webinar for this group isn't a good way. Maybe they need hands-on where they're actively coding things. So make sure that where you're spending the money, it's going to a good use. And then reevaluate those schedules and reevaluate where your resources are going. So, your budget is kind of like a breathing entity where you're always moving it and working on it, and it's always in flux where you're shifting things over. So you always want to be taking a look at things to make sure everything's running the way you want it to and that you're getting out of your steps what you think you should be getting out of them. And then, of course, your timelines, once again, for a solo or small medical practice, the conversion over to ICD-10 can be a very short process maybe. They don't have to be doing work, 2 years out like some practice that has a facility that has 220 physicians. Of course, your curve is going to be bigger the more providers that you have because you're going to have to work with all of them individually, and you can't do that all at once. You can't take 200 and some odd providers and just say, okay, all of you are going to close the practices and we're going to do these training sessions for a whole day. It's just not reasonable to see that that can be something done. But if you have smaller solo practice, doc, we need to talk about this, and you can get things done in a much quicker manner. You may just use a simple Excel spreadsheet, and just check it off. Okay, we did that. Okay, we did that, and just kind of keep moving around through it. So depending on your size, your implementation efforts, may be a lot easier. And then that phase 1 training, again, as we talked about earlier, step 10 would be starting that. And that, again, as we talked about before, would be like your senior managers, your cross-functional teams, coding and billing, so just everybody. Everybody's going to need phase 1. Now, you may want to break them off in ways like we have listed here and say, okay, we're going to meet with the senior managers as one group instead of trying to have a mixture of people, because even with the phase 1 training, when you're talking to it, you're going to kind of speak differently to a physician about ICD-10 and their concerns about it and their maybe frustration with it versus a manager, their office manager about ICD-10 and their frustration with it. So everybody's going to have kind of a different angle to it. So if you're larger, maybe break the phase 1 training down into groups like this where you have like-minded individuals together because they might need to brainstorm on what the best way would be, to get the physician involved, or what would the best way be to have administration, come in, that kind of thing. So once again, as far as the training opportunities, you're looking at audios and conferences and workshops and distance learning, different kinds of things like that can be used to do this. And then the business process analysis, that's kind of a more in-depth assessment of the needs, how they're changing along with a review of the medical practice. Again, as we had said before, like with those surveys you send out, this is more of a detailed analysis looking at the clinical side, the administrative side, billing, and the others, like how are you reporting PQRI and things like that. Education and training, then phase 2 would be your more detailed training same kind of things as you did before, where maybe we are breaking it down into groups, into specialty groups. Even with coders, sometimes you will have groups where you have the cardiology coders, and then you have the pulmonology coders. So if you have your coders broken out like that to give them specific training to their specialty area. Same thing with the providers. When you're working with the providers at these other points, if you can break them up by specialty area, they're going to get much more out of it. Also here, as you see on the next slide, it discusses the people included in this phase 2, the hire, the coding and billing staff, of course, physician and the practitioners, clinical staff, administrative, managerial, depending on what kind of things that they do in their jobs. You may or may not have all of these people in your phase 2. So you kind of have to see where it works for you and who needs that really in-depth kind of training. Policy change development is step 13, and that is something that I would say that you will want to wait to do until you get the payors sending you their new policies, because you don't want to do all this work ahead of time thinking that this is what the payer will do or what Medicare might want and make a change, and then you get something from CMS and the other carriers and payors that say, well, this is what we're going to do, or this is how our appeals process is going to be now. So when you get those from the payors where they give you what their new policy changes are going to be, then of course you may need to change your policies to match. So this is a step that you may or may not, depending on where you live and how many payors you deal with, you may or may not have to do or have to do a lot of. 14 is our outcomes measurement. That's trying to measure productivity. Once we have gone live on the system, reevaluating our documentation. AAPC Physician Services, we do ICD10 readiness assessments. It's a good idea to, consider something like that, or internally try to do something like that, where what we do is we look at the documentation, the chart notes, or the EMR records, but we only look at the diagnosis portion. Excuse me. So we will not, be looking at what did you level the visit at or any of that kind of information. What we do is we take a look at the documentation and then look at how it was ICD-9 coded, and then look and see the possible ICD-10 codes, or could it be coded in ICD-10. You remember from, again, from yesterday on the fracture thing, when we were talking about the fractures and needing to know, is it initial care, is it subsequent care, is it delayed healing, is it normal healing, is it an open or a closed fracture, is there a malunion, is it the right or the left? We may be looking at documentation in a way that the providers aren't used to doing for us today, that they don't have to do it for us to be able to ICD-9 code it, but they're going to need to do it for us to be able to ICD-10 code it. So you don't want, August of 2013 to be the time you start talking to them about that kind of stuff. So you can have an assessment of their diagnosis, of how they're documenting their assessment and plans, and then work with them, and I would suggest doing it by disease process. Because if you have a physician and you say, we're going to take these 20 records, and out of these 20 records, we randomly pull them, and I have maybe 6 different diagnoses to talk with you about as far as ICD-10 goes, and you're on about number 5, you're going to be losing them. So do it disease by disease. Start with diabetes if you're an endocrinologist or family practice. Once they've got diabetes down, then move to hypertension. Once they've got hypertension down, move to some other disease. So if you do it disease by disease and try to work with the physicians on the specific documentation they'll need to do for ICD-10, it might be a little bit easier. So that's something, that we can kind of take a look at. And then, of course, testing your coding and billing staff for proficiency. Any AAPC certified coder will have to take an ICD-10 CM proficiency test in order to keep their credential. So that is something that can be checked on the website to make sure that it has been done. And then give any additional training if doing these measures, you see that there's some deficiencies. 15 is the actual deployment of the code by the vendors to us, and that's when the software update delivers the ICD-10 system and the mapping, if it's going to be used on the systems themselves. So that is going to ensure that we're ready for our go live on October 1st of 2013. So they're going to have to do any internal customization, taking a look at that, integrating changes into the production systems, testing them, testing it with the clearinghouses, especially to make sure the claims are going to flow right, and to make sure that the vendors are going to update, maintain those updates to the coding during the transition period. They're going to freeze the code set from 2014 through 2012 to 2014 to give us time to get used to it. And then implementation compliance, that is the go live. That is when we start using it. So that will be October 1st of 2013, and then it won't change again until October 1st for 24. They're going to freeze it for 2 years for us so that we can get used to it. So we're going to look at, as we talked about yesterday, the claims denials, insurance carrier policies, documentation assessments, measuring productivity, all of those kind of things that we were doing before and that we were doing to get ready, we're going to have to do over again once we go live to make sure that it's still running right. So our jobs are not going to stop October 1st of 2013. It's just going to kind of start all over again, but we'll be actively using the coding system at that point. So the prescription for success post-implementation, ensure your staff is trained, especially on the specialty-specific codes that they use, the guidelines of ICD-10, make sure that your policies have been reviewed, any internal changes have been made that are necessary, look at your outcomes measure, testing of your coders to make sure they understand what's going on, making sure the vendors have done their jobs, everything's installed properly, everything's been tested and runs right, and then just, keep looking at records. Keep on top of the denials and keep on top of the appeals and everything else that's going to be being done, and watching and working with the health plans, because I think, on both sides, provider and payor, there may be some bugs being worked out once we first go live. So just patience on everyone's part as we try to move through this great transition that we're having. And then the last couple slides are ones that were in yesterday's too, so I won't go, it just shows you some of the different things off of the AAPC website, the resource page where you can go and look at all those things we were talking about. Under the links is where you're going to find that RAND study and the Nolan study that I talked about. And then there's the code translator that we looked at yesterday, the GEMS translator. The little office where you can click and see the changes that ICD-10 will make to that part of the clinic. And this is the personal ICD-10 implementation tracker. All of the steps, as you can see going down, that we talked about are on this tracker. It is a free tool to members that you can use to say, well, I started this, or I said I wanted to start this here and I wanted to finish it here, and where you are on the line of your implementation. It'll color code out for you. It's a pretty neat little tool. So that's something that's there for you to use to help you in your implementation to ICD-10. There is my information, and I am now, Carol, finished with my presentation. Thank you, and I am ready for questions.
Yeah, we've got a couple questions, and I know we're a little short on time.
Yeah, I'm sorry.
Yes. Oh, no worries. It was a great presentation and a lot of information. I did chat to everybody back. That idea of doing a survey is a great idea, and I know one free tool, which is monkeysurvey.com, which is a free tool.
Yeah.
Yeah, pretty easy to set up and roll with it, as are those tools on your website, which are terrific. So I'm going to try to I've got a couple questions I'm going to ask you, and then if I don't get to your question, which I'm not going to be able to do that, please reach out and email Betty directly, which that would be great. So just a couple, try to squeeze a couple in here. First, why is the 5010 upgrade being mandated for 1/1/12 if ICD-10 isn't being implemented until 2/1/13? And can you start submitting ICD-10 codes before 2/1/13?
the answer to the last part of it, you cannot submit ICD-10 codes until October 1st of 2013. If you submit them, they're just going to get rejected because at this point they're not recognized as being valid, true diagnosis codes or procedural codes. The reason why the 5010 data transaction set is being mandated to be done first is that they didn't want, or my thought process on it is that, you know, in fact, they were going to do the 5010 in January of 2012 and do ICD-10 October 1st of 2012. And people actually asked Congress to move it back again because they didn't think we would be ready, because with the transaction changeover to 5010, the electronics and what's going to have to be done and the testing and making sure that system works, they thought it would be too much. There'd be too many bugs to work out to try to do them both at the same time. And that's kind of the reasoning why they said, okay, well, we'll do 5010 first and get over to the new electronic data interchange, and then we'll convert our coding over.
You recommend trying to convert earlier and converting the transaction to 9 when sending, that earlier and converting the transaction to 9 when sending external.
I apologize. I don't exactly understand that
Neither
question.
do I. I don't understand that question either. If that member could provide a little bit more
they could email me. Yes.
Yeah, or email Betty directly. I'm actually reading that verbatim. Didn't quite get it myself. We had a couple people ask related to vendor recommendations. That's something else that I'd also like you to email Betty directly, since that'd be great. And that member said yes, he'll email you to get further clarification on that question. Any other questions, please email Betty directly. Please check out the resources on their website. They've got a lot of help in this area. And Betty, I think we'll talk offline about the procedural codes, ICD-10 procedural codes, and get that set up as well. Thank you, everybody, for your time. Both recording from today and yesterday, as well as PDFs of the presentation, will be uploaded to the members-only area within 24 hours. Betty, thank you so much for your time. This is terrific.
Thank you. Thank you, everyone.
Bye.